Good afternoon, Paula. Thank you very much for that. As Paula said, I'd like to thank the organisation committee for putting together such a diverse program. It's been great 3 days, so congratulations on that. And as Paula mentioned, my name is Simon Windsor. I'm the Manager of Research, Governance and Ethics at Southern Adelaide Local Health Network. And today my presentation is titled From Getting Ethics to Getting Involved, Supporting a Research Culture through Student Placements in the Office for Research. And I'd like to firstly thank Patrina Kaspersky for her efforts leading this innovative program and working closely with all of the students that have been involved, and Karen Saxty as well, who's supported Patrina. And I would also like to thank Alexandra Mudd for preparing the abstract for this and conducting the survey with the Flinders University students. So I'd like to, there we go, acknowledge the Kaurna people, the traditional custodians of Adelaide land, Adelaide Plains. That's where I'm speaking from today. We pay respects to the elders past, present and future. We recognise and respect their cultural heritage, beliefs and relationships with the land, and we acknowledge that they are of continuing importance to the Kaurna people living today. So as a bit of a context, I thought I would just touch on the health network that I work in. So I'm part of Southern Adelaide Local Health Network in the Office for Research. Our main location is Flinders Medical Centre, which is a major public tertiary teaching and hospital, which is co-located with Flinders University. And the broader network sort of footprint is 8,000 staff across 20 sites, and there's 40 departments. And we've recently launched a research direction, and the research direction talks about 4 fields of inquiry. So it's trying to look at research culture with an inquiry mindset. And there's 4 fields. One of the fields is implementation, science, and continuous improvement. So these are kind of some of the ways we're trying to introduce the staff here in Southern Adelaide into some research concepts and how to look at, preparing to solve problems that they've identified, and then hopefully look at sort of bringing it towards broader research proposals in the health services research or clinical trials, and we also look at discovery science. So that's the 4 fields, and kind of some of the sort of catchphrases are be inspired, ask questions, see opportunities, and think creatively. So that's the sort of context of the sort of space that we work in. And so what we've started to do is looking at how we can sort of build some relationships around that sort of with that sort of workforce and with the emerging workforce. And so sometimes researchers talk about getting ethics or writing a protocol for the ethics approval, and then classically there's some negative connotations around ethics and governance processes and delays associated with some of this work. And that's not sort of exclusively a South Australian item. It's sort of felt throughout the world. And so we're looking at sort of building a research culture where clinical staff are keen to get involved in research. Researchers are linking in with clinical staff. So we've got that academic and clinical interface. Students are encouraged to see the benefits of research for practice, and research involving consumers and members of the public is prioritised, and different ways of funding that. And so trying to move beyond completing paperwork as a box ticking exercise. So the idea that we had was to have student placements in the Office for Research, which is 1 week immersive experience for Flinders University high degree students. That was the sort of concept. And so, what if we gave them an immersive experience? They were like part of the team for a week. And the aim was to guide them through the theory, the practice, and the application of ethics and governance with sort of local real life scenarios, as well as others taken from history and around the world. And this involved negotiation and meeting with university staff to work out which sort of courses it's relevant to, and where they wanted to place it. And a lot of the feedback was very, they were very keen to have some of this, industry-based learning, which is, what they absolutely wanted to work through. And I guess on the flip side, with us, we were looking at bringing, inviting students into our workplace and opening your door. It may put you in a sort of vulnerable position, but it also gives a forum for that sort of feedback, and for us to sort of explore our practices and how we're, working with the code or the national statement, and then we can reflect as a team as well. So we put a bit of a placement plan together, and we had done other things in the past. So we had an open door policy. We could do virtual meetings. There was drop-in sessions. You could book an Eventbrite. We could have group discussions with clinical trial coordinators. And we've also got a research week in September. That's an annual showcase as well. But yeah, we wanted to do more. So the idea is 1 week in the office for research. The students, they complete a workbook and a case study. So there's a variety of case studies they can select. And so the placement involved a mix of in-person group activities, individual reading and critique of material, attending the Southern Adelaide Clinical Human Research Ethics Committee to see how an ethics committee operates, and as well as involvement in sort of real submissions with supervision with our team here. But we also work with the South Australian Department of Health and Wellbeing to capture the placement on the central placement program called Place Right. And to do that, we had to build a new category of placement called research. So that was all very well. And a lot of the people that we met with and sort of worked on deploying this were very keen to basically open this up to more people. So some of the impact that we looked at, so we had 21 placement participants have completed the program, and they from a variety of postgraduate and high degree courses. So we've had medicine, social work, pharmacology, music therapy, sleep medicine, paramedicine. And we also had, through word of mouth, 4 staff complete the program, and they're from oncology, cardiology, and ear, nose, and throat units. And so I guess we've shown that once you get some momentum in this space, you can actually sort of reap some rewards. And I guess that's for both parties. 2 of the students have joined the ethics committee, and we've also had 1 student join the research council. And in the previous slide there, that's Reham there, and she had a blog in the college, with her feedback and how the placement went for her. And she's now joined our research council, so she's seeing all of the the strategic plans firsthand, which is very exciting as well. And we also had an opportunity to reflect on on this first sort of year of working on it. And obviously some of it was impacted by COVID. And we found that the placements working sort of remotely were not interactive enough. And so we could explore other models to ensure that we have that sort of level of engagement. But for this type of industry-based learning, that sort of relationship you do build up, it's a major factor in that. And the students were really sort of grateful of the opportunity as well. So that was the other aspect that was a real benefit from that. So yeah, working with colleague Alexandra Mudd, she conducted a survey, and we have some of the results for the survey there. And yeah, it was very encouraging feedback from this sort of first cohort of students, and they found the experience good or very good, and particularly relevant to their work and study and where their sort of career aspirations. And they would recommend the placement to their peers. Yeah, most of them used many aspects of the knowledge that they sort of acquired after the placement, which is really encouraging. And we also let them provide some sort of free text and you know, where they could describe what yeah, what they felt, and yeah, they found it to be extremely useful program as well. And some of the specific feedback was they liked doing the good clinical practice module, getting a certificate there. We also had some training resources to the Global Health Training Centre. So there's some other sort of public health type aspects that we're looking at. And the work that we presented kind of fit quite well with that 1 week program to really introduce people into the way ethics committees review research, and also some of the governance systems that hospitals use to manage their research. And some of the other feedback was that they'll use it when they're designing their future studies, and how the ethics committee review, and also how to look at progressing studies from a observation into an actual sort of research program as well. So that was really encouraging. Yeah, as I've touched on, some of the aspects that we've identified were that the Zoom, the COVID restrictions did impact on that quality for some of the participants, and that's obviously unavoidable in the current context. But I guess another aspect was that the students were really surprised at how approachable and helpful that the team here is. But there is the perception that yeah, you shouldn't approach them. You can't be involved in an ethics committee. Research governance is too complicated to work it up. So and so I guess reflecting on where we're at, some of the next steps for our student placements are looking at some other disciplines, so working more with nursing and some medicine to expand the engagement. We have worked with some high schools, so we're deploying some of this material to high schools, and there's a local high school and 35 students completed the workbook and quiz that that Katrina set up. And we're also looking at community organisations. So one of them, University Third Age, but it could apply to other community organisations, Rotary or Kiwanis or Lions and these sorts of groups. Also looking more staff doing this sort of, placement and sort of getting the general skills in the workforce up there. But also looking at considering a community practice, potentially. Maybe there's some people involved in this conference that would be interested in establishing a similar program in their sort of precinct, and we would be interested in sort of collaborating. But yeah, I think so. Some of the key take homes are that yeah, the office an ethics committee and a governance review process is a group of professionals, and I guess that's where we've been able to meet these students, work with them, and then hopefully they are well equipped. No matter where they go in Australia or abroad, they can work and conduct their research sort of ethically and efficiently, and continue building those relationships. So that covers everything from me, and so thank you very much.